Hi, I'm Shannon Villalba with HIME Wellness, and I am here with HIME practitioner Chris McLaren, who is a Qi Gong expert and practitioner and plays the crystal singing bowls. So we're just going to do a little introduction here to Chris because I know he's got so many wonderful things that he does, and I want everybody to know. Yeah. So Chris, how did you get started in your practice?
I think like a lot of people, my practice started because I had issues with my tissues, so to speak, and was looking for relief from constant body pain. So I started practicing Qigong in 2004. Really liked it, saw some results pretty quickly for me, and I've been doing that now, since 2004. I started teaching in 2012. A friend of mine had owned a yoga studio and said, "Hey, would you like to teach Qigong?" And I'm like, "Sure." So since 2012 through now, I've been teaching Qigong. And I think in 2017, I became a registered yoga teacher. So I teach yoga and Qigong. And I play the crystal singing bowls.
So tell us about the singing bowls. How did you get into singing bowls?
Yeah, singing bowls are awesome. I'm very sensitive to sound. And part of my healing journey involved listening to the bowls played by other people. And it basically helped me to heal my body. And when I find things that work for me, it's like, okay, some other people may have the same issues, and let's share that experience. So, probably 7 years ago, one of my good friends, Ron Esposito, plays crystal bowls, had been playing for 20 years. Went to some of his concerts and just found some really profound relief mentally and physically from the vibrations of the bowls.
So that the singing bowls coupled with Qigong, that's a really good combination for healing. Yeah. Tell us a little bit about what is Qigong?
Yeah, excellent. So Qigong is a 5,000-year-old or older practice from China. Qigong means Qi is energy. Gong means to work with. So it's to work with energy. So in a Qigong practice, what we're doing is we're tuning into our body. We're moving through intention and attention, moving energy through our body in various movements and postures.
Okay. So when you're doing that physically, then that can also help with your flexibility, similar to yoga, right?
Similar, yeah. For Qigong, most of the movements, it's more of a meditative practice. Okay. There are some gentle movements if you're challenged mobility-wise and still want to have a spiritual practice, or just work with your body in a very, very gentle way. Qigong is a great way to do that.
So what is the difference between Qigong and Tai Chi?
Yeah, I get that question a lot. So if we go back 5,000 years ago, kind of the energy world was divided into martial arts, which is where the Tai Chi comes in, and then the medical healing arts, which is where Qigong comes in. So they probably started somewhere in a cave in China somewhere. The difference, why I explain to people, if you practice Tai Chi, it is definitely more movement-based. All right, so Qigong is the practice of energy work. So Qi means energy, Gong means to work with, so it's working with energy. And in a Qigong practice, what we are doing is we're doing gentle movements. For example, one of the movements is we just move our hands in a circle in front of our body. Very simple, very easy, but what we're doing is actually balancing our body's energy channels by those movements. We couple that with intention, some inner mantras, if you will. Like one of the mantras is all my energy channels are open. So we're visualizing that energy moving through our bodies as we do the physical practice. The combination of those helps your body to get more energized, helps to release energy blockages, helps you to heal faster. Probably the biggest thing is it's less stress, less anxiety. I feel like you're better equipped to deal with what the world throws at you with the Qigong practice. So very meditative, not super physical, very good for folks that are looking for just a gentle contemplative practice.
So this is a great practice for people who are like seniors or have limited mobility, or they're cancer patients and lying in bed.
Yes. Yeah. So I have, that's exactly right, Shannon. Great for folks that have mobility issues or what have you. I have lots of folks, you can do all these exercises sitting in a chair. I have folks that's how they do it. You can do them laying down as well. It's a little more challenging on your shoulders sometimes, but you can do the exercises standing, sitting, or lying down. So it's great for folks that have limited range of mobility and different things like that.
Okay, thanks, Chris.
Yeah, thank you.